Hello everyone, this is Dr. Sam and today we have lower limb X-ray views and their indications. For assessing the sacroiliac joint, AP, AP oblique, PA and PA oblique views can be taken. For the pelvis, AP view can be used for dislocations, fractures and degenerative disease. The AP outlet view is for trauma, pubic rami fractures and lesions. The AP inlet view can be used for pelvic rim widening or narrowing as well as fractures. For an acetabular fracture, internal and external oblique views, which are called Judith views, can be taken. And the flamingo view is used for pubic symphysis instability. Now we have hip joint. The AP view is done for hip joint evaluation, proximal femur fracture, dislocation, degenerative disease, and examining orthopedic devices. And an additional lateral view can also be taken. The Clemens-Nakayama view is for bilateral femoral fractures. The Dunn view is for femoroacetabular impingement. The abduction internal rotation view, the Van Rosen view, is for hip dysplasia in pediatric patients. The femur has two views, AP and lateral, for fracture, dislocation, osteomyelitis, and foreign bodies. Now we have the knee. The first is the AP view. It is used for fractures, dislocations, foreign bodies, and osteoarthritis. The oblique view is done for fractures and degenerative disease. The lateral view is mainly done for arthritis. Lateral view with a horizontal beam is used for lipohemarthrosis, in which blood and fat from the bone marrow leak into the knee joint. And also it is used for fractures and dislocations of the femur, tibia, fibula, and patella. AP weight-bearing view is done to check for knee alignment and also in osteoarthritis. Beckler method intercondylar view is done to check for locked knee. The Rosenberg view is for early osteoarthritis. The Skyline-Lauren view can be used for patellar fracture and subluxation. And the Skyline-Merchant view is also used for patellar fractures and subluxation. The tibia and fibula have two views, AP and lateral, used for fractures, dislocations, osteomyelitis, and foreign bodies. Now we move on to the ankle. The first is the AP view. It is used for fractures, dislocations, post-operative implants, and to check the tibiofibular clear space. It is the groove between the distal tibia and the distal fibula. The Mortise view is used to check distal tibia, the two malleoli, the talar dome, talar injury, post-operative implant evaluation, and osteoarthritis. The lateral view is to check for fractures, dislocations, joint effusion, and calcaneal fracture. For specific trauma cases, a horizontal beam lateral view can be performed. The AP stress view can be used for syndesmosis and deltoid ligament evaluation. Here we have weight-bearing views which are used for fragment position, post-operative implant evaluation, and for fracture healing. Now we have foot views. The dorsoplantar view can be used for fractures, joint abnormalities, soft tissue effusions, and foreign bodies. Similarly, medial oblique and lateral views can also be taken, but we can also check for osteomyelitis and displacements. Now we have weight-bearing views, dorsoplantar, medial oblique, and lateral to check for malalignment and foot pain. The canal view, which is the medial oblique axial talus view, is used for talar neck fractures and osteonecrosis. The hind foot views include the alignment view, which is to check for ankle and foot instability, and Broden's view for fracture and subluxation. And for the calcaneus, we have axial and lateral views to check for fractures. And finally, the toes. The AP view is used for gout, osteoarthritis, fractures, and dislocation. The weight-bearing medial oblique view can also be used as an additional view. And a lateral view can also be taken, and the sesamoid view is used specially for sesamoid fractures. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.